Hi, everyone, our listeners, viewers. I'm here today with Tyler of CopperHill and Christine, uh, also from of CopperHill. I'll let you guys introduce yourself, and we'll take it from there.
Yeah, hey everybody. Tyler Wax, CEO and co-founder here at CopperHill. Great to meet you all.
And Kristen Wyckoff, VP of Professional Services at CopperHill.
Great. So in the series, we focus on Monday CRM or Monday in general partners with the focus on different industries. Why don't you tell us first a little bit about your company and also if there's a specialty on industry or something you kind of focus more deeply on. I would love to hear about that as well.
Sure. Feel free to kind of ask me to elaborate. I'll try to condense it as much as possible here. But long story short is we are a software consulting, implementation, and development firm. Specialize and really have kind of built a niche in integration, CRM, and all things data. So warehousing, BI, analytics, AI, everything, above and below. In terms of specialization or industries, we've found a very heavy focus across healthcare life sciences. There's really a lot of complexity in that industry, especially on the integration and data side, integrating with EHR, EMR systems. And those challenges have really fit our team's unique skill sets in a way that has allowed us to stand out in the industry.
Very nice. So I think one of the my first realizations when I joined Monday and started working on the product is just how flexible it is. And you kind of intuitively, prior to working here, CRM is for sales. That's just kind of this basic thing that you just know. And then you're like, why is it just for sales? Like if the system works in a certain way, like a funnel type of way, you can basically implement it in various industries. I just had a conversation I mentioned prior to the call with the education, with the partner that focuses on education. Then they use it for schools and to, maintain connections with teachers and parents and stuff, which is like very original and unique. How do you see this implementation in general, I guess, as a general approach in healthcare? Are we talking hospitals? We're talking clinics? Where does it actually meet the customer?
Yeah, lots. When we think about healthcare and direct patient care, it could be private practices, it could be ABA therapy, it could be behavioral health, it could be physical therapy, right? Anything where we've got referrals coming in, right, that we need to respond to and cultivate and qualify, and then helping them go through the journey of, hey, I got referred by my primary care physician. I need to get through and do insurance qualification and do scheduling and right get into treatment into care, right? So it's not just for sales, it's anywhere where we've got people or companies that are coming to us. We've got to do something to help them kind of get through their process. Um, Same thing on the life sciences side when we think about biotech, biopharma, clinical trials, right? We've got research and development going on. And so we've got these beginning stages where we're starting to find interest and do market research. And again, who would be good targets, right? And how do we cultivate that kind of referral network all the way through tracking, right? The phases and the gating of getting from, hey, I have an idea to FDA approval and commercialization. So the CRM is super flexible. And again, it's all about relationships, right? And we've got people and processes and companies, and we got to take them through the process.
Yeah, 100%. And is there a sales process within this? Like, do you still use it as a sales tool in general, or is it like a completely modified way of looking at it?
There are sales aspects, right? So when we think about healthcare and life sciences, obviously, as much as the core of those businesses to treat patients or develop treatments for patients, they are also businesses, right? And there's a monetary aspect. So, when we think about patient healthcare in Monday and in the CRM, we're collecting information and understanding what is their insurance, right? How are we going to get paid? We're going to submit a claim to insurance or we're going to do self-pay, right? So there are kind of non-traditional sales aspects. It's a little bit of a different flavor of it, but certainly, right, most of the companies we work with are businesses, not nonprofits necessarily. And so they do need to make sure that, they have reporting capabilities and processes and the data in the CRM to capture that revenue information.
Got it. And so let's just to take it a step back. How did you even got into it? Usually from my previous conversations, there's kind of like this uh, initial customer way back when, and then you kind of start to become an expert in this field, even though you might not have been kind of thinking about it or planning. Do you have like a situation like that as well?
Yeah, I mean, I think it's probably similar to that, right? I mean, we in working across integration, right? You're talking about connecting front end systems and back end systems. Working primarily on the CRM side, then integrating with whether it's an ERP, a data warehouse, an EHR, EMR. We acquired a number of clients in the healthcare space. I think, again, kind of going back to that unique skill set of being able to offer both the ability to consult and understand what someone's needs are around improving their own internal processes, but then also deliver a very technical project when it comes to connectivity and integration and data was a unique skill set. And I think once we realized that, we wanted to kind of connect that into an area that generally had a lot of challenges and difficulty in that space, which was and is healthcare and life sciences. You're dealing with a lot of security. You're dealing with a lot of a lot of data in general, and a lot of connectivity challenges in integrating those tools together. So once we started to really work with a few clients in that space, we realized how good of a fit that we were together in helping our customers execute their goals, and just kind of went full steam ahead. I guess that was eight years ago now, in that area.
Yeah, that's very interesting. So if you kind of map out, I guess, the people who you serve, your customers, what is the challenge that you see kind of, I guess maybe the most popular challenge that people come to you with, that 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 Monday, and specifically maybe Monday CRM, is the solution that supposedly trying to fix that.
Yeah, I think it's kind of that notion of they've got patients to treat, right? And so again, they've got this influx of referrals, and they need a way and a tool and technology to know again who that person should be routed to. How do we get them into treatment as quickly as possible? So leveraging the CRM capabilities, and then as Tyler mentioned, the integration, right? So electronic medical record systems, that's where all the clinical information lives. And so being able to quickly and seamlessly take this person we now are aware of who needs treatment, capturing the appropriate information in the CRM, engaging with them, right? And kind of shepherding them through that process to the point where now we've got their chart created in the EMR, right? Kind of magically on the surface, right? But it's a huge challenge in healthcare to get the systems connected with the goal of getting patients into treatment as quickly as possible, right? To help them get well.
And so, do most of these already come with a maybe different system? Maybe they come already as a Monday users that they need help of navigating. And maybe as a follow-up, or I guess a bigger question is, have you seen this change over the years? Tyler, you mentioned 8, 9 years that you've been doing this. Um, 9 years ago, yeah, there's like one, two big CRMs out there. Now there's more. Obviously, Monday CRM exists 3 years and we're doing extremely well. But there's still this kind of learning curve in, especially traditional industries. My conversations in construction and law, and this is still kind of behind the technology. We're not talking SaaS, high tech that everybody always looking at the latest tool. Um, so how do you see like let's say the majority of our customers, the knowledge or the know-how that they already have in this space?
Yeah, I mean, my thought, and Kristen, feel free to elaborate on that on this question, but I mean, one of the biggest things that we see is there's always a need, right? There's always a need to solve a problem. And I think what we found as we go into clients is that, some people will try to band-aid a need with a product. And they'll end up having a number of point solutions across their environment that they've implemented to try to solve needs, but really they haven't addressed the main pain point of process, right? And that's where I think our skill set comes into play in combining and working side by side with a Monday is understanding what the processes are that a client has, where the improvement needs to be, right? So again, having done thousands of these, here's where we see a more efficient way to operate specifically in this area. And then, how can you implement that? And how can you adopt change management across your organization as you then roll out that technology? And that's really what's going to make it valuable. And then connecting it into other systems, having the integration components. But that's really, I think, one of the biggest, areas that we're seeing right now to address that.
Yeah, and I think our clients kind of run the gamut of where they're coming from, right? We've got some clients that are on paper and faxing. We've got some that are using Excel in very impressive ways, right? But it's still a very kind of offline process. And we've got some who are coming from very complex, over-configured, right? And so we're trying to kind of pull back and streamline. And I think some of the changes we've seen with our clients outside of just the technology is how they engage with their patients, particularly if you think kind of post-COVID, right? And everything went online and there was this need to have like instant access to scheduling and my information and telehealth and right, that all kind of boomed. And it pulled back a little bit, but that I think created a huge kind of shift in how our clients engage with their patients, right? And it's not enough to just say, yep, come see Dr. Peters on Thursday, right? We now have this engagement layer, which the CRM handles really well, where clinical systems sometimes do not, where we know, okay, this patient's coming in for this new thing. What are the barriers that are going to prevent them? They're nervous. They don't know what to expect. They don't know what the cost is, right? So all these things where we're engaging with the patient kind of through their journey to persist, right? And get into treatment and right and engage with us. I think that's been a big shift kind of over the last 5 years.
Yeah, that's very interesting. One of the first things I was working on when joining the team was kind of building some marketing materials for healthcare as Monday CRM, and suddenly seeing I was like, yeah, you can move a patient through intake is kind of like a lead, right?
Yeah.
And qualification, same thing. Like instead of SDR calling you, there's someone at the hospital that checks you out, seeing where you need to go, and if you're even in the right place. So all these things kind of suddenly make total sense once you just kind of introduce
Yeah.
the solution. Um, and so you mentioned that you've seen hundreds, thousands of these layups. Can you kind of maybe remember a story where you saw this setup of Monday or maybe a different CRM and you were like, wow, what is this? How did you even maybe you were impressed or maybe you were just shocked, but we love these kind of
Yeah. Probably a little bit of both, kind of shocked and impressed. Um, I think when we see clients who have the best intentions, right? But maybe either self-implement or work with a partner that doesn't necessarily understand the healthcare space or the structure of the electronic medical record systems. We've encountered several clients who have almost set the CRM up as a clinical system. And although a CRM can do a lot, right, there are certain regulations and compliance, right, that the clinical information for claims reimbursement and kind of getting paid and Medicare and CMS have to be in a certified EMR. And so trying to recreate all of that in a CRM, while it is very impressive, is not necessarily going to solve their problems, right? Um, and so with that, we've seen where we've got the same patient in there 15 times, right? Because if you think about patient care over time, it's not always they come in once and we never see them again, right? If we think about chronic care management or behavioral health or, right, we've got this kind of master patient and then we have all their visits, right? And we've seen sometimes where the CRM is constructed in a way that as opposed to having that relationship type model, we've just got, right, John Doe 15 times for every time that we've seen them, which again kind of gets us through that initial process. Sure, right? The patient's here, I need to get them through intake, but it doesn't then give us a whole picture of this patient over time, right? And kind of seeing what they've been through, treatment recommendations, reporting. So those are some of again, it's really impressive what people have built and constructed, but not always necessarily the best fit for what they're looking to accomplish.
Yeah, I can totally understand that because even as a user of, let's say, the app of my clinic or whatever, it's hard for me to find when I'm the only
Right.
person the system is built for, it's hard to find certain details just for myself, maybe
Yep.
test results or something. Suddenly you have thousands of patients with thousands of different processes that they're going through. It could be a mess. So if we kind of look at it from more of a strategic approach, what would you say is a common mistake or the wrong approach when when you even start to build a system like that for your business?
Yeah, I think our approach is always to kind of understand the business, right? Completely, even if we're not implementing for everybody and for every process, kind of understanding what is happening now, sure, but where do we want to get to? You don't want to build something now for, 10 users and for just the patient intake process without considering the downstream effects, right? So, what are the other systems you've got in your infrastructure? Who else needs access to this information? When do they need it? What kind of analytics do we have to do? So, I think not getting a complete picture of the business requirements and the business needs and doing more kind of like spot implementation is certainly a concern and can cause issues down the road, right? It causes adoption issues. We've got data issues. So really making sure we understand completely what our clients are looking to do now and, 5 years from now.
And don't try to implement an ERP in your CRM.
Right.
Can you elaborate on that?
We've seen those attempts.
Yeah.
What does it look like?
Yeah, I
Uh,
think using the systems for what they're meant for, right? An ERP is a finance, accounting, inventory, right? You've got your GL in there and let that stay in there. There's a lot that's already built into those type of applications. Same thing with the clinical systems. There's a lot that's already built in there and use them for what they're good for, right? Use the CRM for what it's good for and then connect them, right? Don't try to force things to fit into an application that don't necessarily fit there.
So do you see a potential conflict between if I'm a hospital, let's say I've never heard of a CRM in my life, and I have a system already. It's probably, I would guess, kind of old. Maybe it's been built, 20 years ago, and we've all been using like everybody, the staff, the accounting, everybody in the hospital know how to use it. And then, maybe there's a new administration or something, and they're like, we need to move on. We need to, uh, be more tech oriented and streamline processes. Let's bring in a new tool. Let's say it's Monday CRM, but you have this entire thing. Obviously, the what we like to call stickiness is it's as sticky as it can get because it's 20 years of working on the same system. How do you even, you're saying use the platform for what it is, for what it's meant. That original system was meant for a hospital, and a CRM could be anything. And
Yeah.
so how do you even start to think about this challenge?
Yeah, I think there's a couple things. Hospital systems, great example. They are fairly antiquated, and so they are good at certain things for sure. They are good at encounters and invoicing and claims and billing, right? And that should stay there for what it is meant for. When we think about now we're layering in this other tool, I think it's, typically we're not coming in to necessarily replace everything else in the infrastructure, right? Sometimes we replace certain parts of it or consolidate, but again, the CRM is not going to replace all of your systems, right? So I think it's kind of identifying where can this tool help, right? So when we think about again that initial inbound funnel of referrals of communication, we've got faxes. We can plug an eFax tool in so you don't have to sit there getting the paper off the fax machine, right? We can have emails come in, we can have text messages come in, we can have phone calls come in. So kind of alleviating some of the administrative burdens that we typically see on these older, huge systems. We automate it, right? We leverage automation, we leverage plugins, we leverage AI, right? It all comes in. We have, again, all the automation capabilities of a CRM that don't typically exist in some of these other systems. It helps everything work better. So I think identifying where the right departments, processes are to leverage the specific capabilities of a CRM and not trying to onboard everybody in every process at once, right? Sometimes we have to get kind of a smaller group, get them on the platform, start kind of seeing how it works, build our champions, right? Even when we go through an implementation, we're pretty adamant that we don't want one person, right? We need to have people representing the people using the system so that it builds their confidence in it. They've had influence over it. They become our champions when we think about change management and rollout. And to your point, how do we get it sticky? It's lowering fears about using a new system, barriers. I don't know how to do this, right? Between our implementation team and the client's champions, right? That's where we kind of mitigate some of that change management risk where people are like, okay, I don't know how to do this, right? I'm just going to walk away or use the old system, right? So I think it's definitely tactical and strategic when we're looking to go into an existing infrastructure. And the goal is really to target where can we have the most impact and not try to boil the ocean, right? Let's start with one group, get them on the platform, show the value, show the capabilities, and then right, it kind of starts spreading like, oh, we're using this new Monday CRM tool. Look at all it can do, right? And then it starts growing the interest within the company.
Yeah, I love hearing that. And I'm also like while you were talking, I was thinking, um, well, the old systems are there's a limit to them in terms of they were programmed in a way that there are certain things that we didn't even dream of back then that these things can be automated. And so the system ends and then a human needs to do the rest. But now there's a lot of the things that we're used to the humans used to do are also can be replaced or automated. And so that kind of leads me to my next question, and you kind of alluded to this AI. So again, you've mentioned you've been in this industry for close to a decade at this point. AI is, getting bigger and bigger. How do you see it in your day-to-day, in your implementations, maybe also the way customers are even aware that these capabilities are out there?
Yeah, there's probably not a client who hasn't heard AI, right? I think a lot of it is education on what it really is, right? And what it can do. I don't think there is a, black and white, hey, client, here's how you should use AI. It really depends on what their business is, um, who their customers are, right? How much of this kind of agentic interaction will their customers feel okay with? When we think about healthcare, right, the notion of ambient AI, right, where I can have, this agentic tool listening as I'm meeting with my doctor, right? That's great because it's capturing the sentiment of the conversation and right, all the notes are getting documented. Some patients don't understand what it is, right? Or am I comfortable? So again, how do we start educating not only our clients, but our clients' customers, right? Um, and when we think about kind of programming these AI tools, whether it's something like that or let's recommend the best physician for you to see based on your preferences, your geography, the physician attributes, right? To kind of matchmaking, right? We can use AI to do that. We can help identify trends in population health, right? So where we start seeing certain demographics and diagnoses and treatments and what's effective and right. So there's all these things we can use it for, and it's super powerful. But I think it does come down to what do our clients do? What will their customers feel okay interacting with? Um, but then, these AI tools need data, right? And so we also have to kind of think about what are the data sources? Where are we going to get information to train these models and put the guardrails up so it knows when it's like, okay, that's not something I should answer. You need to talk to a person. And so part of what we think about with our clients is what does your data look like now, right? If we've got jumbled, not necessarily great data, the AI tool is not going to work well. It could give wrong information, right? And we certainly don't want that. So it's kind of two-pronged on where can we leverage these very powerful tools, but then what information, what data sources do we have to train the AI tools so that they know what the appropriate response is, again, where those guardrails go up, what other outside data sources, right? So we can certainly have public data sources that we pull in, but the client's data is typically very important, right? Their patients' data, their organization's data, the claims data. And so we really need to look at that too and help them with data strategy as a first step before we can even get to the AI piece.
Yeah, that's very interesting because I haven't even, only while you were talking, I realized how big you're talking to a client, but you can't ignore that they have their own clients. It's like a
Right?
double, it's you might be a B2B provider, but you have to consider the C. You have to consider the consumer, the customer at the end of the road because they potentially might interact with the system directly as well.
Absolutely. Yep.
And especially when we're thinking of this really sensitive data. This is not just sure, like a sales deal, details need to be confidential. But the worst case is still not someone's personal,
Right.
information that could leak or could be misinterpreted, and that's obviously much higher stakes.
Yep, for sure.
So at the end of the day, we're here to talk about obviously Monday and Monday CRM. You as power users, obviously, you've seen these implementations. I just wanted to maybe get your take on maybe some features that you like or processes that you got a chance to implement. Um, how do you see the system itself and where its strengths are at?
Yeah, I think one of the biggest strengths of the Monday CRM is its, kind of simplicity on the surface, right? And it's easy for people to adopt, and the navigation is very intuitive. Um, Under the hood, we can do a lot of powerful things with the automation and right, the integrations. And I think there's a lot of CRMs available, right? And some of them are very niche and point solutions. Some of them are overly complicated, right? And Monday has kind of created this nice space where it is simple, right? And people can adopt it easily. We don't need to spend 8 months implementing and 8 months training and right. Um, but it still has a lot of the capabilities of the larger, more complex CRMs without bubbling that up to kind of that interface layer. And I think that's been really refreshing for us and for our clients to again to be able to still build these really cool things, right? But in a way that the users of the system, right? We always have to keep our users in mind. We could build the best system in the world. If they don't understand how to use it, it doesn't matter, right? And the Monday CRM has done a nice job of allowing us to build the data models that we need to support relationships in healthcare and the automations and the integrations, but still be a really low barrier to use because it is very intuitive and people are comfortable in the interface.
Yeah, and do you have maybe something comes to mind when we were thinking of a specific implementation that you did, or maybe someone on the team did, that you're like just really proud of what you've built there?
Yeah, I mean, there's a lot we're really proud of. I mean, I would say one of the areas that's been coming up a lot recently is kind of around ABA therapy. And so when we think about, right, so these are children, right, that we're getting into therapy. And so, I mean, kind of the underlying purpose is very meaningful, obviously, but we've been able to connect to the relative systems, right, so that we can get those initial referrals in. You know, with something like ABA therapy, it's not as simple as here, go see this doctor, right? There's a lot that goes into getting insurance approval and how many sessions and when are they available and the provider's capacity and right, there's a lot that goes into it. And so being able to leverage the CRM for all of those relationships and capturing it, plugging in tools to get faxes, to get the medical records, to get the diagnostic information, right? Getting all of that in one central place, which we need, right? Because now we're going out to insurance to prove that this is medically necessary, right? So again, it's getting this patient through treatment quickly so they can, or through intake so they can get to treatment quickly. Um, Scheduling, we built a really cool scheduler, shameless plug, but it's awesome, right? And it sits on the Monday platform, and that's a huge part of any patient care, but ABA in particular, we've got minors, right? And so we're dealing with their caregivers, and there's different kind of specialties within ABA. And so being able to build this scheduler tool inside the platform, which again is kind of the last hurdle before we are able to get them into treatment was really cool, right? It's powerful for our clients to now have this tool that does all of this for them. That, on Monday at 8 a.m. I can get a referral, and by Wednesday we're ready for treatment, right? That's awesome.
Yeah, that's powerful stuff, as they say. Uh, it's funny, like you talk about it, obviously very with a lot of passion, and as you talk about, I'm like, how do we do it so far, right? Like, there's stuff that becomes so like obvious once they're done properly, or the technology is there, and you kind of can't think of going back. And
Yeah.
to think that people wait months for bureaucratic
Yep.
processes, even though maybe the funding is there, maybe the people are there, maybe, but it just all these processes, it's such a sorry,
Yep.
pain in
It's
the
a
ass
lot. Yeah, it's a
for
lot.
all of us, for everybody in their day
Yep.
to day. Um, yeah, that's great. And by the way, uh, shameless. There's no shame, and like that's what we're here. If you created the solution, we're definitely here to promote it. And I'm glad people get to know that it's out there.
Yeah.
So yeah, we're kind of approaching the end of our conversation, and usually I have two final questions. You kind of already answered one of them, which was how do you approach new customers, as in what's the audit, but you kind of talked about it, unless you want to elaborate further. But my last question is, how do you define success? Obviously, you have a ton of different customers and different solutions and situations. Um, how do you know that you've done well, and is there a way to measure that success?
Yeah, I think certainly adoption of the platform, right? And so when we think about an implementation, a lot goes into it, right? But when we hit the go live phase, um, we intentionally keep our projects going, 4+ weeks after go live. And part of that is so that we can make sure there aren't any hurdles to adoption and that we're giving our clients the support, kind of this hypercare period. And so we can start seeing, right, are people using it? Are we getting questions? We can see the data going in and out of the system. So certainly that, right? Are they using the system? I think outside of that initial hypercare period, we also want to keep in touch with our clients. And are they asking us for enhancements? How else can we use the platform, right? Keeping it sticky. So we kind of keep an eye on that, right? And we have outreach and touch points. And um, when we have integration in play, right, we can, through our middleware tool, we can see that the data is moving. So that gives us some good insights too. And if all of a sudden we see, oh, there hasn't been any data movement in a week, what's going on, right? Is it right? Have they stopped using the system? Is there something in the tech, right? So we can keep an eye on that too. Um, and we obviously do kind of the normal customer sat surveys and post-implementation reviews and everything like that. But I think the best measure is if people are actually using the system, right? And so if they are using it by default over time, they will think about other things they want to do in the system. They will think about other applications they want to connect to. A lot of we hear like, oh, we want more reports, we want more dashboards. Great, right? That means you're using the system and you're starting to think about how we can get stuff out of the system that's valuable. So I think there's no necessarily, super, this means it's successful, but certainly they've made an investment in this technology and are they getting value from that investment, right? And so again, adoption, enhancements, data moving, engagement with Monday with us, right? Kind of shows that they're using the platform and the investment that they've made.
Yeah, that's the satisfying and you know what drives a lot of the passion in our organization is that our success is directly tied to our client success. So if they're successful, we know, that's a direct tie to the work that we've been able to deliver, collectively, and the relationship that we've been able to build. So that's what ultimately kind of gives you that satisfaction at the end of the day too, is you're not just kind of handing something over and you're not sure if it's made an impact or not. We're in there really shoulder to shoulder and hand in hand with our clients, so we know where the impact is.
And I guess as a follow-up to that, you have clients that are with you for a long time because
Yep.
there's always
10
new.
years, we've been in business 10 years. We've had clients for 10 years. So,
Oh, wow, that's amazing.
yep.
Yep.
So every time something comes up, you already like, I mean, from us, from Monday, a new feature, a new capability, you already have those people that you interact with that are in your database that you work with on a
Mhm.
weekly basis, and you just look for new opportunities to implement.
Yeah, I mean, we look to partner with our clients. We don't want to be, a technology vendor, right? We want to be your technology partner. And so we understand your business. We know the people, the players, the politics some of our clients have to deal with, right? Like we get to know all of that as we go through these implementations. And so we do have a lot of clients that, sure, we do our initial phase, we get this department up and running, and then over time, we've got other phases of work and we continue to expand the capabilities and add integration and reporting and write all the things. So yeah, we tend to work with our clients kind of for the long haul, which is great, right? I mean, you get to know these people and relationships, and like Tyler said, we see them being successful, which is awesome, right? We helped them do that, right, in our way.
You said other phases, and I immediately thought other faces because in 10 years, there's probably half the people in the company will probably changed
Also true.
roles or left, and new people came in and
Yep.
maybe decided to change the strategy, and it's a whole thing. It reminds me of my agency days 10 years ago. Um, yeah, well, this has been an awesome conversation and eye-opening to just how powerful and impactful not only Monday in general can be as a kind of a generic tool that can fit into everything, but also just to think of like the end users, like the really important, like
Yeah.
we can talk about tech all day, but when we're talking about patients or kids, or this is a
Yep.
different level of conversation, which just to think that there's a positive impact there is really awesome. Thank you both for your time. This has been great. To our viewers, listeners, check out CopperHill and the team. They seem like nice people with a lot of knowledge. And yeah, have a great rest of the week.
Thank you, Danny. Appreciate it.
Thank you.